Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Frozen shoulder. Frozen shoulder, sometimes called adhesive capsulitis of the shoulder, is a condition where shoulder becomes painful and stiff. Shoulder movements become reduced, sometimes completely frozen. It is thought to be due to scar-like tissue forming in the shoulder capsule. Without treatment, symptoms usually go, but this may take up to 2 to 3 years. Various Ayurvedic treatments including Panchakarma can ease pain and improve the movement of the shoulder. What are the symptoms of frozen shoulder? The typical symptoms are pain, stiffness, and limitation in the range of movement of a shoulder. The symptoms typically have 3 phases. Phase 1, the freezing, painful phase. This typically lasts 2 to 9 months. The first symptom is usually pain. Stiffness and limitation in movement then also gradually build up. The pain is typically worse at night and when you lie on the affected side. Phase 2, the frozen, stiff, or adhesive phase. This typically lasts 4 to 12 months. Pain gradually eases but stiffness and limitation in movement remain and can get worse. All movements of the shoulder are affected. However, the movement most severely affected is usually rotation of the arm outwards. The muscles around the shoulder may waste a bit as they are not used. Phase 3, the thawing, recovery phase. This typically lasts between 1 and 3 years. The pain and stiffness gradually go and movement gradually returns to normal, or near normal. Symptoms often interfere with everyday tasks such as driving, dressing, or sleeping. Even scratching your back, or putting your hand in a rear pocket, may become impossible. Work may be affected in some cases. There is great variation in the severity and length of symptoms. Untreated, on average the symptoms last 2-3 years in total before going. In some cases, it is much less than this. In a minority of cases, symptoms last for several years. Who gets frozen shoulder? Frozen shoulder affects about 3% of adults at some stage in their life. It most commonly occurs in people aged between 40 and 65 years. It is more common in women. It is more common than average in people who have diabetes and some other conditions, including overactive thyroid disease. Either shoulder can be affected, but most commonly it is the non-dominant shoulder, that is, the left shoulder in a right-handed person. In about 1 in 5 cases the condition also develops in the other shoulder at some stage. Note, frozen shoulder is not a form of arthritis and other joints are not affected. What causes frozen shoulder? The cause is not clear. It is thought that some scar tissue forms in the shoulder capsule. The capsule is a thin tissue that covers and protects the shoulder joint. The scar tissue may cause the capsule to thicken, contract and limit the movement of the shoulder. The reason why the scar tissue forms is not known. A frozen shoulder occasionally follows a shoulder injury. However, this is not usual and most cases occur for no apparent reason. Do you need any tests? The diagnosis of frozen shoulder is usually made by a medical examination. You may also have an X-ray or an MRI scan of your shoulder joint. These tests are usually only done if the diagnosis is not clear, to exclude another cause of your symptoms. So, many people will not actually need any tests. What are the treatment options for frozen shoulder? The aim of Ayurveda treatment is to ease pain and stiffness, also, to keep the range of shoulder movement as good as possible whilst waiting for the condition to clear. One or more of the following may be advised to help ease and prevent symptoms. Anti-vata drugs. Vata drugs are advised to ease pain. Shoulder exercises. These are commonly advised. The aim is to keep the shoulder from stiffening up and to keep movement as full as possible. For most benefit, it is important to do the exercises regularly, as instructed by an Ayurvedic doctor. Panchakarma. Sometimes, you are advised to undergo Panchakarma therapies. Also, you may try other pain-relieving techniques such as warm or cold temperature packs. Exercises. What is the outlook? The symptoms of frozen shoulder can persist for 18 months to 3 years or more. However, the vast majority of people with a frozen shoulder do recover to normal levels of function and movement by 2 years, even without any treatment. It is very uncommon to have frozen shoulder more than once in the same shoulder.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva Sarado Vardhamanaha. Shatam Hemantan Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.